Disclaimer. The information provided in this video is intended for entertainment and general informational purposes only. While we strive to present accurate and up-to-date content, this should not be considered medical advice. Always consult with a qualified healthcare professional or trusted medical source for guidance on health-related concerns, including those related to the Mpox virus. The content provided here is for educational purposes and should be verified with authoritative sources before making any health decisions or taking action based on this information. What's something people don't know about the Mpox virus? In the spring of 2022, the world faced a new and unexpected health challenge, the Mpox virus. This virus, which had previously been confined to certain regions, suddenly began to spread at an alarming rate, catching many off guard. Previously known as Monkeypox, this viral disease quickly spread across multiple continents, sparking concern and uncertainty. The rapid transmission highlighted the vulnerabilities in our global health systems and the need for swift action. Mpox is a zoonotic disease, meaning it can spread from animals to humans. This characteristic makes it particularly challenging to control, as it involves monitoring both human and animal populations. It is a stark reminder of the interconnectedness of human and animal health. The health of our ecosystems directly impacts our own well-being, emphasizing the need for a One Health approach that integrates human, animal, and environmental health. The outbreak highlighted the importance of global health surveillance and preparedness. It underscored the necessity for countries to work together, sharing information and resources to combat the spread of infectious diseases. Mpox is a viral disease that causes a range of symptoms, from fever and rash to more serious complications. These symptoms can vary widely, making it difficult to diagnose without proper medical testing. It is a member of the orthopox virus genus, which also includes the smallpox virus. Understanding its genetic makeup and similarities to other viruses in this genus is crucial for developing effective treatments and vaccines. While Mpox is less deadly than smallpox, it still poses a significant threat to public health. The potential for severe complications and the ease of transmission make it a virus that cannot be ignored. The 2022 outbreak raised many questions about the virus's origins, transmission, and potential impact. Scientists and researchers around the world scrambled to understand how it spread so quickly and what measures could be taken to contain it. The virus's sudden emergence underscored the need for accurate information and effective public health measures. Public awareness campaigns and timely updates from health authorities became essential in managing the crisis. Understanding Mpox is crucial for individuals, communities, and governments to respond effectively to this evolving health threat. Knowledge empowers us to take the necessary precautions and support public health initiatives. By learning about its history, symptoms, and prevention strategies, we can better equip ourselves to navigate this new challenge. Education and awareness are key components in the fight against infectious diseases. The 2022 outbreak served as a wake-up call, reminding us of the ever-present threat of emerging infectious diseases. It highlighted the need for constant vigilance and preparedness in our global health systems. It highlighted the importance of investing in public health infrastructure, disease surveillance, and global cooperation to prevent and control future outbreaks. By strengthening these areas, we can better protect ourselves from the next health crisis. Mpox, formerly known as monkeypox, is a viral disease that belongs to the orthopox virus genus. This genus includes other viruses like smallpox, cowpox, and vaccinia virus. Mpox is a double-stranded DNA virus, which means its genetic material is made up of two strands of DNA. This type of virus is generally more stable than RNA viruses, making them less prone to rapid mutations. The virus can spread from animals to humans through close contact with infected animals or their bodily fluids. Contact can occur through bites, scratches, or handling of infected animals. The virus can also spread through the consumption of undercooked meat from infected animals. Human-to-human transmission of Mpox occurs through close contact with an infected person's bodily fluids, such as saliva, respiratory droplets, or pus from lesions. It can also spread through contact with contaminated materials like bedding or clothing. While Mpox is less transmissible than some other viruses, such as measles or COVID-19, it can still spread efficiently through close contact. Understanding the different modes of transmission is crucial for implementing effective prevention measures and controlling the spread of the virus. The history of Mpox dates back to the mid-20th century, a time when the world was still grappling with numerous infectious diseases and the scientific community was fervently working to understand and combat them. The virus was first discovered in 1958 in laboratory monkeys in Copenhagen, Denmark, hence its former name, Monkeypox. These monkeys were part of a research project aimed at studying various viral infections. These monkeys were being used for research purposes, and the virus caused a smallpox-like illness among them. The symptoms observed were similar to those of smallpox, which had been a major scourge for humanity for centuries. The first human case of Mpox was not identified until 1970 in the Democratic Republic of Congo, during a period of intensified efforts to eradicate smallpox. This discovery was significant as it highlighted the presence of other pox viruses that could affect humans. This case highlighted that while smallpox was being eradicated, other related viruses like Mpox continued to circulate in animal populations and could potentially infect humans. The scientific community realized that vigilance was necessary even as one battle was being won. For several decades, Mpox remained primarily confined to Central and West Africa, with sporadic outbreaks occurring in these regions. These outbreaks were often linked to direct contact with infected animals such as rodents and primates, which are natural reservoirs of the virus. However, the 2022 outbreak marked a significant turning point in the history of the virus. Unlike previous outbreaks, this one spread rapidly across continents, catching the global health community off guard. In May 2022, cases of Mpox began to emerge in multiple countries outside of Africa, primarily among men who have sex with men. This demographic pattern was unusual and prompted urgent investigations into the modes of transmission and potential risk factors. This unusual pattern of spread and the geographical reach of the outbreak quickly raised global alarm bells. Health authorities around the world scrambled to understand the dynamics of this new outbreak and to implement measures to contain it. The 2022 outbreak was unprecedented in its scale and geographical scope, leading to the World Health Organization declaring it a public health emergency of international concern in July 2022. This declaration underscored the urgent need for a coordinated international response to prevent further spread and to protect vulnerable populations. Tracing the roots. Where does Mpox come from? Mpox is considered endemic in several Central and West African countries, where it is found in both animal and human populations. While the exact animal reservoir of Mpox is still unknown, rodents are suspected to be the primary host. Several rodent species, including rope squirrels, tree squirrels, Gambian pouched rats, and dormice, have been found to harbor the virus in these regions. These animals can carry the virus without showing any symptoms, making it difficult to track and control the virus in these animal populations. Human activities such as deforestation, encroachment into wildlife habitats, and the bushmeat trade increase the risk of contact between humans and these potential animal hosts. These activities can drive animals closer to human settlements, increasing the likelihood of spillover events where the virus jumps from animals to humans. Understanding the ecology of Mpox and its animal reservoirs is crucial for developing effective strategies to prevent future outbreaks. This includes surveillance of animal populations, reducing human-wildlife contact in endemic areas, and promoting sustainable practices that minimize disturbances to natural ecosystems. Recognizing the enemy's symptoms of Mpox. Understanding the symptoms of Mpox is crucial for early detection and treatment. Mpox typically presents with a range of symptoms that can vary in severity from person to person. These symptoms can sometimes be mistaken for other illnesses, making it important to be aware of the specific signs of Mpox. The incubation period, or the time between exposure to the virus and the onset of symptoms, is usually between 6 and 13 days, but can range from 5 to 21 days. This variability means that symptoms might appear sooner or later than expected, depending on the individual's immune response. The initial symptoms of Mpox often resemble those of other viral illnesses, such as influenza or chickenpox. This can include a general feeling of being unwell, which can make it difficult to distinguish Mpox from other common viral infections in the early stages. These early symptoms typically include fever, headache, muscle aches, back pain, chills, and exhaustion. These symptoms can be quite debilitating, causing significant discomfort and fatigue. Swollen lymph nodes, a distinctive feature of Mpox, can also occur during this early stage. This swelling is often painful and can be a key indicator that differentiates Mpox from other viral infections. Within 1 to 3 days after the onset of fever, a rash typically develops. This rash is a hallmark of Mpox and can help in the diagnosis of the disease. The rash often starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. This widespread distribution of the rash is characteristic of Mpox. The rash evolves through different stages, starting as flat, red spots, then progressing to raised bumps, blisters filled with clear fluid, and finally pustules that crust over and scab before falling off. Each stage of the rash can provide clues about the progression of the infection. The rash can be itchy and painful, and the lesions can leave scars. These scars can be a lasting reminder of the infection and may require additional medical treatment to manage. In severe cases, Mpox can lead to complications such as pneumonia, sepsis, encephalitis, and eye infections that can lead to vision loss. These complications can be life-threatening and require immediate medical attention. While Mpox shares some similarities with smallpox, there are key differences in their clinical presentations. Understanding these differences is important for accurate diagnosis and treatment. Mpox typically causes milder illness, and swollen lymph nodes are a more prominent feature of Mpox. This can help differentiate it from smallpox, which does not usually cause lymph node swelling. However, it's important to note that only a healthcare professional can diagnose Mpox based on symptoms and laboratory testing. If you suspect you have Mpox, seek medical advice promptly to ensure proper care and management of the disease.